Hey guys, hope you're well. We're gonna do a internal hip rotation pails and rails. So what you're gonna do with this is we're gonna be doing it with the wall. I have a variation similar to this, but lying flat. If you get any pinching in the hip, go back to that variation, lying flat on your back and do the same thing. This one is a little bit more advanced. So we're starting to get some hip flexion in there and working on that hip internal rotation. You can do 90-90, you can do many other variations. I like this as a beginner one because a lot of people, 90-90 pushes them past their end range, and then this is just a good beginner variation, either supine, which is one I have on there, or this wall version. Okay, so I'm gonna sit down. I'm gonna have my back to the wall, sit nice and tall. One leg is gonna be straight, one leg is gonna be like this. I'll move over slightly so you'll be able to see. So what I wanna do is so if my leg would be straight out here and actually taking a foot or two out, right? And what I'm doing is I'm using the wall, so my back is to the wall, and then I'm actually bringing that knee down towards the ground. What I'm then feeling around this hip is I'm feeling a nice stretch. If you feel pinching, there's two things you can do. You can either just come a little bit away from the wall, and that allows a little bit of space, or you can go to that supine variation, right? If you can handle this and it's not hurting, then by all means, do this variation. If you're feeling anything through the knee, you can come in a little bit less on the knee. You can just move these around. Any of our pails and rails, find the stretch that's good for you where you're not cheating, compensating, or hurting yourself. We want to be aiming for tissue stretch in this one on that hip capsule. So if you're not feeling it there and just feeling it other places, maybe you do need to try a different variation, right? So I'm gonna sit up a little bit and then I'm gonna go into that. What I'm gonna do, and I'm gonna go out a little bit, there we go. I'm going to feel, now I feel it through my bum and all around here, and I'm gonna use my other hand to just put a little bit of pressure. You don't have to put a lot, we're just getting into that end range, holding that passive stretch. You'd hold for 2 full minutes here, so we're just hanging out there. Then we're gonna do a pails and a rail. So our first set of pails is we are going to be contracting up. We're contracting the tissue we're trying to stretch. So we're making that external hip try to come back up. So I'm gonna start to push up into my hand. So I'm holding that, ramping this up to your greatest effort, 20, then 40%, 60, 80, holding if you need to put both hands, and holding there for your greatest effort for 10 to 15 seconds. If you're contracting max, then you shouldn't be able to do more than that. 3, 2, 1. I'm gonna keep my hands exactly where they are. My knee's gonna pull away. That's my rails, or tissue I'm shortening, is trying to pull away. So it shouldn't be assisting my hand, it should pull away and then stay there. Now my leg is trying to go towards the ground. Hold that again for 10 to 15 seconds. 3, 2, 1, breathe, relax, and then sink into that. Now, when you do your second round, what you can do is you can kind of pull your hip back, sink into it, adjust, etc. But you will feel this stretch on tissue where it's tight. So you'll be stretching all through here, all around the capsule. If it's hard to come out of, which it may be when you do capsule stuff, just help it. And then the next best thing, as always, is to do some hip cars right after. Upload that information. Give that a try. Try your 2-minute